Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and the Gynecology Faculty of Medicine, Mansoura University. The topic of my lecture today about investigation in obstetrics. So what we wanted to discuss today, the investigation first trimester, second trimester, and third trimester. So what is the first investigation in the first trimester? It is the pregnancy test, detecting the beta human chorionic gonadotropin either in urine or in blood, using different methods, either radioreceptor assay or radioimmunoassay or monoclonal antibodies. Monoclonal antibodies is the most specific and the enzyme immunoassay is the most sensitive method. You should know that the beta HCG is doubling every 48 hours in viable pregnancy during early first trimester. This is how the pregnancy test log, two lines indicating positive pregnancy test, one line indicating negative pregnancy test. Another method to detect the pregnancy very early is detecting the early pregnancy factor, which is a hormone that can be detected 48 hours after fertilization. Also, serum progesterone increasing during early pregnancy linearly between week 5 and 13. And if there is drop in serum progesterone, this indicating there is abnormality in this pregnancy, maybe threatened miscarriage, maybe missed miscarriage, and so on. So also you need CBC, blood group, and RH, and very important to detect RH negative women, hepatitis B surface antigen and the HCV, HIV screening, and use opt-out approach. What is opt-out approach? It is defined as conducting HIV testing after notifying patients that the test will be conducted and that they may decline or defer testing. This is her right. Also do blood glucose testing. Maybe glucose tolerance test is needed in some women. Hemoglobin A1C also may be needed. Screening for other infectious disease if you are suspecting, like chlamydia, gonorrhea, and syphilis. Screening for hemoglobinopathy, especially in certain population like some Asian countries like India, because of there is more cases of thalassemia, sickle cell anemia, and so on. Also, you can test thyroid stimulating hormone in women you are suspecting to be having thyroid dysfunction. Urine analysis, you take sample from midstream urine to detect albumin, sugar, fast cells, okay, and to do culture and sensitivity test. And it is recommended to do screening for asymptomatic bacteriuria between 12 and 16 weeks gestation or with the first antenatal care visit. Also, you may test for varicella in high-risk cases. Also, you may collect swabs of vaginal fluid in patient complaining of excessive vaginal discharge with possibility of infections. Okay, what about screening for chromosomal abnormalities between 10 to 13 weeks? We can use cell-free DNA to determine aneuploidy, as we will see in the picture later on. Also, we can use nuchal translucency to detect aneuploidy all this can be done in first trimester. What is confirming diagnosis of aneuploidy is chorionic villus sampling. If cell-free DNA is not available, you can do another more invasive procedure, which is chorionic villus sampling, and test for genetic disorder, especially in patient with advanced maternal age, more than 35 years, or having history of previously affected child or family history. This picture shows you the cell-free DNA testing. We are searching for cell-free DNA of the fetus in the circulation. This one in green is fetal cell-free DNA, this green one, while the violet one is maternal cell-free DNA. We are searching for fetal cell DNA, the green one, but this test is expensive and not suitable in all countries. Some countries has this test, the test is available easily, but it is expensive. The other confirming test for aneuploidy is to take a biopsy or sample, which is called chorionic villus sampling. We take sample of tissue through syringe and the needle under local anesthesia guided by abdominal ultrasound. We take a sample of chorionic villus tissue and testing for chromosomal abnormalities. Okay, all these in the first trimester. As here, also ultrasound is non-invasive procedure, can detect the increased nuchal translucency. As in this picture, you can notice the difference between the normal here and abnormalities here, which is there is increase in nuchal translucency behind the neck of the fetus. As you see here, this is one of the signs of Down syndrome, for example, trisomy 21. Okay, so nuchal translucency can detect about 80% of fetus with trisomy 21 and the other major aneuploidy. If we use nuchal translucency and maternal serum free beta HCG and the pregnancy associated plasma protein A, this test can detect up to 90%. Up to 90%. Okay? So, if we use the only nuchal translucency, 80% of cases can be diagnosed. If we add free beta HCG and the pregnancy associated plasma protein A, we raise the detection to 90%. If we add also the abnormalities in the nasal bone, ductus venosus, flow abnormalities, so we can detect more than 95% of cases. So routine ultrasound between 10 to 13 weeks gestational age is done to establish accurate gestational age, detection of viability, and the number of fetus, is it single or multiple pregnancy. The first sonographic evidence of pregnancy is gestational sac. Can be visualized at 5 weeks, and we know that transvaginal ultrasound can detect earlier than abdominal ultrasound because the resolution of transvaginal ultrasound is better. And you should know that the gestational sac increases in size by 1 millimeter nearly per day in a normal pregnancy. We can calculate the mean sac diameter to detect gestational age, as you see in this picture. In 2 dimensions, longitudinal and transverse, we have 3 diameter. We can get the mean sac diameter and the detected gestational age. This is the first sign of pregnancy by ultrasound. And in the other picture here, you can see this gestational sac, the yolk sac, this circle is the yolk sac, fetal pool, this part. Okay, what about the cardiac pulsation? Cardiac pulsation can be seen at 6 weeks gestational age, especially with transvaginal ultrasound. Between 11 and 13.6 weeks gestation, crown ramp lens is used to determine gestational age. Also, you should know that ultrasound has many benefits, can be used at any time during pregnancy to evaluate the presence of ectopic pregnancy, corneal, tubal, cervical, adnexal, abdominal, also cesarean scar ectopic. Free fluid in the pelvis, uterine and adnexal pathology, fetal cardiac activity, heart rate, miscarriage signs, or gestational trophoblastic disease. All of these can be diagnosed by ultrasound. Two anatomical approaches usually used to visualize pregnancy using ultrasound: transvaginal and transabdominal. A transvaginal using high frequency endocavitary probe placed into the vagina and visualizing the pelvic organs through the cervix, and has the advantage of having a better resolution and more accurate diagnosis, especially early in pregnancy. Transabdominal ultrasound using lower frequency sound wave can be used to visualize pelvic organs, but does so by looking through the abdominal wall with curvilinear probe. Of course, transabdominal ultrasound has the disadvantage of less resolution than transvaginal ultrasound. This thick abdomen interfere with the beam of ultrasound to detect the very small lesions, so the resolution is less with transabdominal ultrasound, especially in obese patients. The difference in frequency with the probe's anatomical placement during the exam result in the transvaginal approach being superior for visualizing a very earlier pregnancy as well as evaluating the next. Deciding which modality of ultrasound to use is multifaceted. Anatomy, age, weight, and the beta HCG level should be considered. It is reasonable to start first with who? With transabdominal ultrasound, as this is less invasive. Full bladder is ideally for performing abdominal ultrasound, as it provides an acoustic window. If the transabdominal approach is indeterminate, the transvaginal approach can be used. So, if abdominal ultrasound cannot give you better picture or resolution or image, and you cannot diagnose very well, so at this moment you should use transvaginal approach. Okay, what about second trimester investigation? We investigate for fetal heart tones using Doppler sonicate, as in this picture. We put this probe on the abdomen after applying gel, and we can measure the fetal heart rate, which appear on the monitor like that. Ultrasound performed between 16 to 20 weeks for fetal anatomy and the dating, and for detecting any fetal anomalies. Okay, we As regards screening for anomalies or chromosomal anomalies like aneuploidy, so we can use quadruplet test, which is composed of alpha fetoprotein, human chorionic gonadotropin, estriol, and inhibin A. And the amniocentesis can be done in certain cases if suspecting aneuploidy and you wanted to confirm, you can do amniocentesis, especially in high-risk patients like patient above age 35 or previous affected child and so on. Amniocentesis from 15 weeks for high-risk cases of chromosomal anomaly, as I said. Also, we can do CBC, especially if the patient is anemic and we wanted to do follow-up. This picture shows you how to do amniocentesis guided by ultrasound under local anesthesia, needle inserted inside the uterine cavity, taking a sample of amniotic fluid, and this needle should be away from the placenta and the fetal body and the umbilical cord. What about third trimester? In Rh negative women, you should apply to them repeated Rh antibody testing between 24 to 28 weeks gestation. Group B streptococcal screening is recommended between 35 to 37 weeks. Blood glucose test or glucose tolerance test may be needed in some cases. Urine analysis, complete blood count can be repeated also for follow-up of anemia. Non-stress test and the biophysical profile, this is for fetal well-being, especially in high-risk pregnancy. As you see in this picture, this is non-stress test with two probes, transducer, connected to the monitor, and you can see in this paper the fetal heart rate and its variability and so on. Okay, the patient press on a button if there is fetal movement, and we will have a mark here on this paper with the fetal movement. Normally, there is 2 acceleration of the fetal heart rate within 20 minutes. This 2 fetal heart rate acceleration occur with the fetal movement. This acceleration must be more than 15 beat per minute. Okay. Ultrasound for evaluation of fetal growth during third trimester is important, and also you should know the presentation of the baby and if there is any obstetric complication like any abnormalities in placenta as regard separation, premature separation of the placenta, or any abnormality as regard amniotic fluid, and so on. Measurement of the head circumference by parietal diameter, femoral length, abdominal circumference, and measure the expected fetal weight. Also, sometimes you are in need for umbilical Doppler ultrasound for detecting the fetal well-being in high-risk cases. Diagnosing of placenta previa, placenta accreta, the placental abruption, detection of fetal cord rate, fetal cardiac heart rate and rhythm, and detection of any abnormality of amniotic fluid, oligohydramnios, polyhydramnios, fetal viability. All of these are important tests by ultrasound in third trimester. This is showing you this picture on the left, the abdominal circumference, as you see here, and here the head circumference. The other picture show you femur length, and the left side picture show you all diameters of the head, the biparietal of the head in orange, the occipitofrontal diameter in yellow, and the head circumference in white. Thank you. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura.